In this video, we're going to look at distal fibular glides posteriorly and anteriorly. So for the posterior glide, you can have the patient either in a long sit or supine. You're going to want to block at the tibia. You can utilize thenar for the mobilization hand. You want to be straight down and just providing posterior glide of the fibula. Now for the anterior, you can have the patient go prone. And just going to show you on the foot that's closest to the camera here. So same thing where you're going to create the block, same hand placement here, but this time all you're doing is moving from posterior to anterior with your mobilization.